Hello everyone! How was your day? We hope you are well. Today, we are going to do a presentation on reinforcing a dietary program. Our group consists of Cici, Hilda, Nizar, and myself, Aziza. We are making this video to fulfill the mini project for this English practice for nursing class. In this video, we will talk about definition of dietary program, purpose of dietary program, vocabulary, and useful expression. Please watch carefully to the end and enjoy this video.
Do you know what is dietary program? According to Indonesia Nutritionist Association, years 2009, diet is regulation of patterns and consumption of prohibited food and drinks, others, instruction, or permit in a central amount for the purpose of treating illness, health, or weight loss.
Did you know the purpose of dietary program? Yeah, the point is to maintain overall body health. In addition, diet also aims to achieve or maintain a controlled weight. To understand how to reinforce dietary program in English, there are some vocabularies that we need to know. Some of them are about taste and fruits, also vegetables. Now, I will tell you how to pronounce them in English and its meaning in Bahasa Indonesia.
Taste. There are many tastes that you already know, right? But I'll tell you again. Such as pungent, pedas, spicy, rasa yang kuat atau pedas, hot, pedas, rasa panas di mulut, mild, cukup atau sedang, salty, asin, too much salt, terlalu banyak garam, sour, kecut atau rasa asam.
Fruits and vegetables. There are many kinds of fruits and vegetables that you already know, right? But I'll tell you again, such as an apple, a banana, pisang, a carrot, wortel, a cucumber, mentimun, a lemon, jeruk nipis, a mango, mangga, an orange, jeruk, an onion, bawang, a peanut, kacang, a potato, kentang, a pepper, merica, spinach, bayam. Next to useful expressions. Do you know what are the commonly used expressions? Maybe some of you already know. For those who don't know, no problem. We find out together. First, offering food. Before giving food to someone, especially the patient, it will be better if we offer food to him or her. Some expression that we can use. What would you like to have for your breakfast? What do you like for your lunch? What will you have for dinner? Do you like soup for your breakfast? How easy, right?
Assessment. Of course, as a nurse, you must assess the patient whether the patient has an allergy to certain food or not. If you have allergies, then do not give this food in the patient diet program. Then to ask it, we can ask using a sentence like this. Are you allergic to peanut? Or are you allergic to milk?
Third, explaining a dietary program. The goal is they know why we give their food to them, or they can know food that is good for their health. You can say, now I want to or I'm going to explain the dietary food that is good for your health.
Recommending a diet. These recommendations need to be conveyed to the patient. You can say, okay, you have to go on a dietary program. Consuming fruit or vegetables and drinking a lot of water is good for your health. And the last, you may consume fried chicken a little bit.
Prohibition. Many prohibition experience that you can use to tell them. Do you want to know? Yes, I give you other ways to say prohibition. You are prohibited to drink a coffee. You have to avoid the rice. You have to restrict yourself to eat peanut. You should avoid spicy food. You should restrict yourself to drinking soft drink.
Telling a doctor's diagnosis. Then how to convey a diagnosis from a doctor's? We can convey it in one sentence. Like this. Well, according to a doctor's report, you have a problem with your cholesterol. Or with sentence, well, according to the doctor's note, you have a problem with your stomach.
Rational. Rational is a reason or a logical about something. You can tell them if the patient asks. Consuming excessive sweets will worsen your condition. You can also replace will worsen your condition with will aggravate the blood sugar rate.
Patient's expressions. Of course, the patient will always ask about things related to the food he should consume. Like a patient asking whether he can eat his favorite food or not. Then, if the patient asks like, can I consume a fruit salad? Can I consume a mango juice? May I borrow a new spoon? Of course, we as nurse must always give a positive response and answer like, sure or of course. Other expressions. Some other expressions either from patients or nurse that are usually used. Did you enjoy your meal? Artinya, apakah Anda menikmati makanannya? Do you have any problem with your meal? Artinya, apakah Anda memiliki masalah dengan makanannya? Is the person we provide enough for you? Artinya, apakah porsi yang kami sediakan cukup untuk Anda? Why don't you eat your food? Artinya, mengapa Anda tidak memakan makanannya?
Have a nice meal or enjoy your meal. Artinya, selamat makan. Next, can I take the dishes now? Artinya, bolehkah saya mendapatkan makanannya sekarang? When can I start drinking or having the meal? Artinya, kapan saya bisa minum atau makan? The last, you have to wait until the anesthetic has worn off before you eat anything. Or, don't take anything to eat before the anesthetic wears off. Artinya, Anda harus menunggu sampai obat bius habis sebelum Anda makan apapun. Atau, jangan makan apapun sebelum obat bius hilang. In this morning, in a hospital in Cirebon, to be precise, in the Rose room, there was a patient who had diarrhea and had no appetite. Then a nurse came to help solve the patient's problem. The nurse explained about the dietary program that the patient must run in order to speed up the healing process.
Good morning, Miss Cici. I'm Nurse Hilda.
Good morning, nurse.
How do you feel today?
I feel dizzy and weak because last night I defecated continuously.
According to doctor report, you have a problem with your stomach, that's diarrhea. Now, I want to explain the dietary programs that's good for your health.
Yes, nurse.
Have you had your breakfast yet?
Yes, I have had breakfast each morning and take my medicine.
That's great. Do you have any allergy to some fruit or vegetable?
No, I don't have any.
What would you like to have for your lunch?
May I have fresh or French fries?
Sorry, you cannot. Consuming French fries or fried rice worsen your condition. You are prohibited to drink coffee and eat spicy food. You'd better consume banana, rice, applesauce, and toast. This diet is good for your dietary sufferers because it has high fiber and protein content and low fat. So it's good relieving problems in the digestive tract. And drinking a lot of water is good for your health to prevent dehydration.
Okay, thank you for that diet information, nurse. And now I want to eat rice and vegetable soup for my lunch.
Well, let me tell the person in charge.
Thank you, nurse.
With pleasure.
Thank you so much for all of you for watching us. Let's support our group. If this video is useful, you can like it and share it with your friends and family. Have a nice day.